Basic clinical skills for nurses practice questions.
Question 1. A nurse prepares to take an oral temperature for a client who just drank iced water. What should the nurse do? Option A. Take the temperature immediately. Option B. Wait about 15 minutes before measuring. Option C. Use the same value as the last reading. Option D. Document that temperature cannot be obtained. The correct answer is option B. Wait about 15 minutes before measuring. Cold fluid can fool the thermometer like winter air through an open window. Waiting allows the mouth to return to a reliable baseline. Question 2. While measuring blood pressure, the nurse hears sounds down to 0. Which action is best? Option A. Record 0 as the diastolic pressure. Option B. Recheck using the other arm immediately. Option C. Inflate the cuff higher and repeat slowly. Option D. Document only the systolic number. The correct answer is option C. Inflate the cuff higher and repeat slowly. Technique protects truth. Repeating with proper inflation and slow release helps distinguish real sounds from error, guarding against a misleading vital sign. Question 3. A nurse is assisting a client with a cane. Which teaching is correct? Option A. Hold the cane on the weaker side. Option B. Move the cane with the weaker leg. Option C. Advance the stronger leg first on stairs going up. Option D. Keep the cane far ahead of the body.
The correct answer is option B. Move the cane with the weaker leg.
A cane supports the weaker side by moving with it. This creates a wider base, like adding a third leg to a shaky table. Question 4. A nurse performs hand hygiene before entering a room and after removing gloves. What is the main reason? Option A. Gloves replace the need for washing. Option B. Hand hygiene breaks the chain of infection. Option C. It makes the nurse look professional. Option D. It is only required after body fluid contact. The correct answer is option B. Hand hygiene breaks the chain of infection. Clean hands are the gatekeepers of infection control. Gloves can tear or contaminate skin, so hand hygiene remains the quiet shield between patients. Question 5. A client needs help moving up in bed. Which action protects the nurse from injury? Option A. Bend at the waist and pull quickly. Option B. Use a friction reducing sheet and raise the bed. Option C. Ask the client to hold the nurse's neck. Option D. Keep the bed low during the move.
The correct answer is option B. Use a friction reducing sheet and raise the bed. Body mechanics turn strength into safety. Raising the bed and reducing friction protect a nurse's spine while moving the client smoothly. Question 6. A nurse is inserting a urinary catheter using sterile technique and touches the sterile catheter tip to the bed sheet. What should the nurse do? Option A. Continue if the tip looks clean. Option B. Wipe the catheter with antiseptic. Option C. Discard it and obtain a sterile catheter. Option D. Ask another nurse to hold it. The correct answer is option C. Discard it and obtain a sterile catheter. Sterility is invisible and easily broken. Once the catheter touches a non-sterile surface, replacing it prevents carrying microbes into the bladder. Question 7. A nurse counts respirations after telling the client. The client begins breathing faster. What should the nurse do next time? Option A. Count respirations while appearing to check the pulse. Option B. Ask the client to breathe normally. Option C. Skip respirations if pulse is normal. Option D. Measure oxygen saturation instead. The correct answer is option A. Count respirations while appearing to check the pulse. Breathing changes when watched. Counting discreetly gives a truer picture, like observing a bird before it notices movement nearby. Question 8. A nurse assists with feeding a client at risk for aspiration. Which position is safest? Option A. Supine with head flat. Option B. High Fowler position. Option C. Side lying with chin extended. Option D. Trendelenburg position. The correct answer is option B. High Fowler position. Upright positioning uses gravity as a safety partner. It helps food travel toward the stomach instead of wandering toward the airway. Question 9. A client has a new prescription for a wound dressing change. Which action is most important before starting? Option A. Open all supplies on the bed. Option B. Assess the wound and review the order. Option C. Remove the old dressing quickly. Option D. Apply tape before cleansing. The correct answer is option B. Assess the wound and review the order. Preparation begins with knowing the wound and the prescription. The nurse cannot choose safe steps without first reading the map and seeing the terrain. Question 10. A nurse is teaching crutch walking. Which finding requires correction? Option A, elbows slightly flexed. Option B, weight supported on hands. Option C, crutch pads pressed into the axilla. Option D, tripod stance used before walking. The correct answer is option C, crutch pads pressed into the axilla. Crutches should not dig into the armpits. Pressure there can injure nerves, turning a mobility aid into a source of harm. Question 11. A client has difficulty swallowing pills. Which nursing action is safest? Option A, crush all medications together. Option B, check whether each medication may be crushed. Option C, hide pills in food without discussion. Option D, give pills while the client lies flat. The correct answer is option B, check whether each medication may be crushed. Medication form matters. Some pills protect timing or location of release, so crushing without checking can unlock the dose at the wrong moment. Question 12. A nurse measures oxygen saturation on a client with cold fingers and dark nail polish. What should the nurse consider? Option A. The reading may be inaccurate. Option B. The value is always reliable. Option C. Pulse oximetry replaces respiratory assessment. Option D. Nail polish improves sensor contact. The correct answer is option A. The reading may be inaccurate. Technology needs good conditions. Poor circulation or polish can distort light detection, so the nurse must compare the number with the patient in front of them. Question 13. A nurse is making an occupied bed. What should the nurse do to prevent skin injury? Option A. Pull the client across wrinkled sheets. Option B. Keep linen smooth and dry. Option C. Leave damp linens until bath time. Option D. Place knots under pressure areas. The correct answer is option B. Keep linen smooth and dry. Skin dislikes pressure and moisture. Smooth dry linens reduce friction and breakdown, protecting the body like a well-fitted layer of armor. Question 14. A nurse gives a bed bath to a dependent client. Which area is washed last? Option A, face. Option B, arms. Option C, perineal area. Option D, chest. The correct answer is option C, perineal area. Clean to less clean guides bathing. The perineal area is washed last to reduce the spread of organisms to cleaner body areas. Question 15. A nurse is preparing to transfer a client from bed to chair. Which action comes first? Option A, lock the wheels on the bed and chair. Option B, place the chair far from the bed. Option C, ask the client to stand without help. Option D, remove non-skid footwear. The correct answer is option A, lock the wheels on the bed and chair. A safe transfer starts by stopping movement that should not happen. Locked wheels create a stable platform before the client shifts weight.